My name's Noel. I'm a psychotherapist. Welcome to this blog today, which is looking at men and addiction, or gender and addiction, really. Just a quick note. I'm going to stick with a relatively simplistic definition of gender for this, whilst not trying to reinforce those stereotypes, those sort of binary stereotypes. And I'm aware that things are much more complex than that. I guess why I'm going to stay with that sort of simple term, men and women, is just because those stereotypes are leading to types of behaviour out there which have an impact on the way people move into addiction and then possibly move into recovery. I say possibly move into recovery because it's not guaranteed that people will. But if we look at the routes in and then the routes out, and very much sort of hone down the various cultural and political and social factors that lead to using and to potential recovery, then I think it's really important that we focus on that. And then people, once they're in recovery, can then think about who they actually are. I think the difficulty of trying to figure out your identity while you're using is hard work for most addicts. So that's a sort of caveat on the terminology I'm using. I hope it doesn't cause upset or offence, but the reason for it are because people are dying out there through these activities. So I think it's really important to get a message across to people. We know that that men in general have a higher risk of dependency and addiction around a whole host of behaviours and drugs. And in typically, sort of men and women will have different types of dependencies. Women will tend to have dependencies more around prescription type drugs, and men will have more dependencies around alcohol and illicit drug use. I think the sort of evidence that we have is that it's about age at starting, which is a really, really important predictor of sort of development of serious problems. So if a young woman starts and a young man starts using at the same age, and they have the predisposition towards addiction, and then the social factors that push them towards that, in terms of family or environment, etc., then they're likely to develop a serious problem. So that's what we know. It tends to be that guys get involved in using at an earlier age, they get exposed, and that's one of the big risk factors here. It's very much seen in that binary term as part of male culture to use, to get very drunk, to use lots of drugs, to engage in that very explicit sort of risk-taking behaviour. And that has later life impacts in terms of addiction use. And it's important to understand that in terms of when you're sort of working with guys. The other impact of it is that until relatively recently, without this gender distinction, the assumption in most sort of treatment services for addiction have been sort of male bias. I mean, that's the truth. So if I give you a small example, home treatment often works better for women than men. And there are multiple reasons for that, mostly cultural and political. And it may be to do with childcare arrangements, etc., etc. It may be to do with trying to hide, for women certainly trying to hide their drug use from authorities if there are children around, etc. But it typically does work better for women to sort of have a detox at home and services brought to the home, and outreach done in that way, than requiring women to necessarily go to groups that are very male dominated, such as AA. I mean, 3/4 of Alcoholics Anonymous are men. So there's a real issue there. The damage is pretty significant for both genders, but of course the longer you're using, the more damage that you're going to get. I think in terms of sort of male psyche, issues around dependency are complicated for guys, and that needs to be worked through in terms of treatment, looking at issues around shame, failure, weakness, and the sort of cultural responses to their sort of male ego and male identity that comes from sort of using. And also, I guess, as you get further into addiction, you're more likely to pick up some of the other sort of illnesses around sort of getting involved in criminality, getting involved in violence, being traumatised. I know sort of many patients that have come to see me that end up sort of in deals that go wrong, and they're just buying drugs on the streets and they end up with a knife stuck in them and things like that. So pretty risky, difficult, dangerous lifestyle. which is challenging to anybody. It's important to understand that stuff so that you can begin to sort of develop specific packages or routes into recovery. The types of things that help, and there's more information on the website. Go and check it out. I've got a lot more facts and figures for you there, a lot more information on it. But just thinking about what works in terms of addiction treatment, it's looking at sort of the medical side of things, so making sure that the detox is safe and medically managed, group therapy, family therapy, issues around nutrition and eating well and eating healthily, fitness training, experiential and expressive therapies, so art therapy, drama therapy, etc. Psychotherapy, of course, holistic techniques, so bringing in sort of a really good detox treatment is the use of sort of touching, tapping, and putting needles into your skin, acupuncture. These are really good sort of non-medical detox treatments. And then looking at aftercare programs. I think essentially what I'm saying is that we need to be very clear about the roots and reasons and why people start using, how chronic it becomes for them, depending on various factors such as gender, such as income, such as cultural setting and cultural sort of messages and environmental messages, where somebody lives, how prevalent use is around them, or how hidden it is, and then think about childcare arrangements, etc. All of these factors need to be brought into thinking about what impacts on somebody's using, and then thinking about how you can reach out to people on that basis and tailor treatment services so that their pathway is made easier for them into treatment, and then you deal with some of those issues, and you work in a multidisciplinary and holistic way, and having people that can work in this sort of very multidisciplinary approach is really helpful in terms of care management after somebody leaves treatment and goes back into the community. I hope that's useful. Slightly longer video today, but I think it's really important. I'm going to be meeting up with a guy called Ali Mordi next week from the Cabin in Chiang Mai, who's really skilled in all this stuff, and it's a great treatment centre, so go and check them out. And I'll be interviewing him more in depth about the sort of work he's doing. He does a lot of work with guys and thinking about the needs of men in treatment, and then when they leave treatment. So it's going to be fascinating to talk to him. I'm going to be meeting him next week at the ICAD conference in London, so that's the 1st to the 3rd of May. Just Google ICAD conference. There'll be a link on the website as well. I'll be there sort of all 3 days, and on a Wednesday morning presenting or sort of managing a presentation in the morning on efficacy of treatment and treatment outcomes in terms of addiction treatment. So come along and check it out. It'd be great to meet some people that I've not met yet. I've just sort of connected on these videos and through social media. So if you watch these and you follow some of my social media channels, do come and say hi when I'm there. It'd be lovely to have a chat and catch up and find out what you're doing. Thanks for joining me today. Please do leave commentary at the end of the video or on the website www.noelmcdermott.net. If you're having issues around needing somebody who can support you in developing your own care plan through a multidisciplinary team, do get in touch with me. It's something I specialise in. I spent 15 years in social services doing that, so I'd be delighted to help. Do give me a call, 07506 319 745. That's 07506 319 745. If you're calling from outside the UK, it's +44 and drop the first 0. Or info@noelmcdermott.net. Thanks for joining me. See you again at the next video. Take care. Bye-bye.